Applications in Personality Testing from Kimberly Ward of Ashford University for Psychology 640. With Mr. I, Mr. I was referred to me after a stay at a psychiatric hospital for psychotic thinking and assaultive behavior. He is a married 46-year-old male. He has a previous diagnosis of schizophrenia and schizoaffective disorder. His sleep patterns have recently decreased and thinking bizarre thoughts as well as seeing hallucinations to do with religious preoccupation and circumstantial thoughts. We are clearly missing pieces. The information given for Mr. I was brief and absolute for the MMPI-2. Seeing as this appears to be the only instrument given to collect data, the conclusions then can also be said to be only pieces to a larger picture, such as an interview, an observation that could have been included to give us a more whole picture. It is recommended that a sleep assessment scale be done to be sure that this is not merely a sleep-related issue. It is further recommended that Mr. I take the irrational beliefs inventory through an interview process. The results of the MMPI-2 remain inconclusive until these two additional tests are given due to lack of information. Validity is compromised on the MMPI-2 until reliability can be upheld through a check on sleep and stress is done. Also, the MMPI-2 is lengthy and the mood can change while in the midst of filling it out. An added measure would be the MCMI-3, as it is shorter almost by half the time. It is also planned and organized in such a way as to clinical patterns consistent with the DSM-5. Miss S is a 29-year-old married female referred for attentional functioning concerns. Has served with the Army for 9 months, where she witnessed a mate commit suicide. Miss S currently has no children and is enrolled in school pursuing her bachelor's degree. She has had multiple surgeries and has irregular menstruation issues. Miss S struggles with concerns over her weight, and over the past several years her attention as well. She does not drink nor use drugs, has struggled with anxiety and depression since high school. The results of Miss S tests show cognitive functioning seems average, though due to some onset of anxiety, a couple of subtests appear low. The achievement evaluation showed Miss S is weak in math, as self-reported, and found through her testing the reading, spelling, and sentence comprehension was within the expected range. Reading comprehension was below expectations, though likely due to her anxiety. With information processing and attention, Miss S was within the average range, except where arithmetic was concerned and her attention dipped. On a measure of sustained attention, Miss S's behavior was consistent with an individual who has an ADHD diagnosis. In the language, Miss S showed no signs of any impairment. On visuospatial abilities, Miss S also shows nothing of concern with no signs of impairment. In memory, Miss S shows no signs of learning new information and obtaining it other than a slight delay where attention is required. There was a mild impairment in executive functioning. However, Miss S was highly anxious during this time and is likely the reason for poor performance. On her personality and mood, she showed signs of exaggerated reporting, most likely due to her anxiety and reduced attention. She shows symptoms of tension, agitation, and depression. She shows a pessimistic outlook on life at this time. The recommendations I would make for Miss S would be that she would follow up with therapeutic counseling and see if a tutor can potentially be provided to assist her in her math understandings. Some projective tests, such as the thematic appreciation test, will likely help the validity of the WAIS to ensure that Miss S' perception of herself does not interfere with the reality of herself. The Inkblot test for word association will also help identify with what she is feeling inside and pull those conclusions and inferences out from that test rather than depend on a self-reported measure. De-stressing her life as much as possible is recommended to decrease anxiety and possibly increase attention. This means that, you know, she may have duties that she has to attend to, but she needs to make an organization chart, a daily chart that can help her organize her daily routines and see where she has free time for friends and family. This concludes my presentation.